Okay, we'll move on to a few more things and wrap up the day. So just give me a few minutes, talk a little bit about funding for AP Triton, the consultants that we hired to help with the program. So just so you understand, again, like I said, in 2015, this program got started. AP Triton came up, kind of educated a lot of the State Chiefs Association about, hey, you should look at doing this program. I took the lead in the role, so I said, I'll do it. And at that point in time, it was obvious to me that I'm kind of smart, but not as smart as I wanted to be in this program yet. I am now. But I knew we need to hire consultants to make sure that we get this done correctly for the state, so we all benefit in our fire departments and see good money like we're seeing now, which is really awesome. I'm very excited about that. So we did that. Central Pierce signed the contract with AP Triton. And the cost for that total package was $560,000. It's a lot of money, and so hang in there. So we hired them for 3 phases. First phase is legislative work to help us write the bill to get passed and all that. So all the correct words are put in place, and it's a good bill that we wrote, Senate Bill, House Bill 2007, all in good place. So hiring them to help with that was huge. And then we go into phase 2, which was working with Healthcare Authority and CMS to get, the SPA developed, the cost reports, the rules, all the stuff done, the documents that we need to get finished and taken care of. So we did all that work with them, which is also good to do that. And then phase 3, of course, is what we're doing right now, educating everybody on the whole process in the seminars. So the cost of that is what it is. And I was able to reach out to several fire departments and get money donated to Central Pierce to help cover the cost of each of these phases for hiring AP Triton. And now looking at ways to reimburse us and help pay back the departments that put in a lot of money, because we're all benefiting, so we're all getting a plus out of this. So an example, Cowlitz Fire 2, Dave Lefebvre, Chief Lefebvre in the very back in the exit. He's ready to run away, I think, but yeah, there he goes. So their department put in $110,000, okay, and that's what they did. And now what the plan is Central Pierce, let's just say, 75 departments sign up in this program, okay? And then I'll get from healthcare, let's use Tacoma Fire as an example. Tacoma Fire in 2017 did 2,000 Medicaid transports, just a number. I'm not saying it's right or wrong, but it is what it is. So they do 2,000 transports. I do the math, and I'll have Tanya and Stephanie help me with that math, but we'll get it done. We'll look at it and go, okay, we could do this over 1 year, or we could do it over 2 or 3 years, and we bill Tacoma Fire 2,000 transports, $1 a transport, $5 a transport, something like that. They send us that check, and we then distribute that money back out to the departments that contributed to this program to help it get going. So that is in place, but you also get the advantage of you put that money into your cost report, and you're going to get a good chunk, if not all of it, back. So you're paying, but you're going to get it back. So it's not going to be a total wipeout in a way. So that's really good. And that's going to happen. That's the plan. And then we'll work with our attorneys to just put a little one-page document together to send to you to sign. This is the contract, so to speak, and we'll get that going and get it in place. We'll try to get that doing sometime next year once we get this thing up and running, get everybody signed up to do it. In addition to that 560, we've spent a little more money to do things with the consultants and whatnot. So there'll be, maybe another 20,000 on top of that. That's pennies in this whole grand scheme of things, not a big deal. So in a nutshell, that's kind of what we're looking at, is how to reimburse and recover those costs that a lot of departments have spent money on to help build this program. So questions, concerns, or thoughts about that? Okay. Good. All right. That was easy. So, question there.
This sounds like a great plan, and thanks to any of the departments that put in up front. That was a great step of faith, and thank you.
Yep, absolutely. Yeah, it was a fun project. I actually enjoyed doing it, so it was good too. So next thing we were going to do our breakouts. Remember in the morning I said who's a city and who's a non-city folks. Talking with healthcare and AP Triton, it's too crazy to split it up. So we're just gonna sit here and I'll bring those guys up to ask and answer questions related to city or county or fire districts, things like that. So you're gonna hear a city question. You may not care if you're a fire district. You're gonna hear a county district question, and you're gonna have that. So we'll do that and then get into pretty much wrapping up our day. So Ken, you and Scott?
Scott and I are available. Any questions?
Where's the other microphone?
Oh, it's right there on the table.
Okay. Because you can have that one, I guess. So if you have questions, or Scott, you want to start with any comments, or? I know, yeah. Any questions?
I'll give you a comment. So as some of you are getting ready to leave, here's what I'll tell you. The cost reporting process, I totally get that this can seem like a daunting task. The reality is if you saw an actual cost report, you would probably be thinking you have an even greater daunting task, because almost every one of those line items has an input of one item or more. So having hundreds and hundreds of line items is common, not unusual. So my point is, with very few exceptions, I have not seen in multiple states, I have not seen where filling out the cost reports and completing the cost reports was not worth participating in the program. There will be some people in this room or some agencies in this room, I will tell you right now, that will bring millions of dollars back to your organizations. There are some of you that will bring tens of thousands of dollars back to your organizations. But if you're bringing back tens of thousands of dollars, it's probably carrying the same weight as millions to the larger agencies. So what I want you to take away from this is, don't let the cost reporting process, you shouldn't be walking away here thinking that this is insurmountable. In California, which is the largest state that I'm working in, there's only 160 public providers. 148 of them participate in the program. The balance that don't participate in the program are because they have extremely high commercial payer mix and they have an extremely low Medicaid mix. I have an agency that did 7 Medicaid transports the entire year. They have a high reimbursement rate. But for them, seven transports, I mean, you'd have to have some pretty substantial cost to make it worth your time. So I don't want anybody walking out of here thinking this is really overwhelming. It's not. You just have to take a look at it, work on it, but I can guarantee you for 99% of you, this will yield huge returns and huge benefits to your organization. Because it's a CPE, you've already expended the money. So there's no federal requirement for how that money is utilized. Whereas with an IGT, not that you're doing them, but they're a little bit more prospective, so they're required to have allocation to what you're going to use the money for. You've already expended the money. So the thing that I want you to think about is, this is what this program was made for. I mean, hospitals use it, schools use it, lots of providers use it. This money is what it's designed for. So for those of you that have some shortfalls, this might shore up those shortfalls. For those of you that are looking to figure out how can I get some AEDs into my community, you might pull down 10 grand or 15 grand in GEMT money. 15 grand is a lot of AEDs that you can purchase. And not that I'm trying to show you how to capitalize on this, but if you bring in $15,000 in your GEMT program and you buy AEDs and you reinvest those back in, you've just increased your allocatable cost by $15,000 for next year's cost report, which might buy you some more pieces of equipment for your engines or your ambulances. And if that's reinvested back, then the following year you have a higher cost and you reinvest this back. So that's what these programs were designed for. That's the benefit to you. So I caution you, don't walk out of here thinking this is a huge task to undertake and not worth your time. It is absolutely worth your time. This is what it's for. This is what will benefit your communities. This will make a difference in the care that you guys deliver. So that would be the last thing I would give you as a takeaway. So I thank you guys for showing up. If you have questions, we'll be happy to take them.
Number of questions.
Thanks for all the information you've provided. Question, you went through a lot of stuff fairly quickly, and as you said, we're not going to be experts at the end of the day on how to fill these out. But given you guys have a lot of experience working in other systems that have implemented this, is there any sort of cheat sheet or top 10 list of things that you can mess up on that we could benefit from? Like, people tend to make errors in these areas. You know, have states given you guys feedback on where there tend to be more flubs than not in certain line items? Anything we could benefit from?
Yeah, Scott, you want to go over that list of common items that you prepared?
I think the state had a slide of really common errors, and you'll have access to that. The biggest error that I find personally in doing cost reports is not having a sound methodology for how you're going to apply shared cost. If you can tie it back to a source document, so in other words, if you're claiming a cost and you can go back to your dispatch log, or you can go back to a time on task study, or if you can go back and identify a source document, that's really huge. I have seen agencies literally use a seat of the pants. You know, how much time do you spend? You're the training chief. How much time do you really spend on EMS? About 25 or 30% of my time's on EMS. That might be accurate, but if you have a time study, that'll really benefit you. I wouldn't say it's a mistake. It's a strategy that I have seen employed. I actually had a department in Florida contact me, and it was very interesting because they intentionally left out costs that they wanted to allocate to the program, and they left those costs out. They accounted for them, but they specifically didn't apply them to their MTS costs. And their rationale was if they go through an audit and they might have to pay money back, this was like their little safety measure. Well, we'll just dump this in for the audit. A, it doesn't work like that, and B, that's not really how the program is intended. It's kind of like those that, you know, don't itemize everything on their taxes, because then that way they've always got something. So as far as a list, it's hard to say. I've seen the gamut. I've seen mistakes with how people. This is actually an interesting thing. So I have a provider in another state, and they called me up and said our numbers aren't balancing. And I'm like, well, what do you mean your numbers aren't balancing? And they kind of had to go into this, and I'm really not in the business of fixing other people's problems. But what they were doing is they had set their budget based upon position costs. And so they had set a budget based on position costs, but what ended up happening is they had 2 people retire, they had 1 person go out on work comp, and they had another individual that left and went to work for another department. And so they had budgetary items on their MTS costs, but in reality what happened was they were backfilling those positions with overtime personnel, and then they were moving their work comp person into a light duty position, and then they were claiming those costs while they were on light duty, filling in a office position, but they were backfilling with, go figure, their seniority-based system, so their top step firefighters were getting the overtime, backfilling for a 1-year paramedic on their crew. So none of the hours and the money that they had allocated balanced when they got audited. So remember that you're going to be looking at positions, but you really actually need to go back and look at your costs. And in their case, they were a small department, and so when they backfilled what essentially was 30% of their staff that were at step 1 and step 2 and backfilled them with step 5 firefighters on overtime, there was a big discrepancy in how they accounted for those hours. So you got to really take a look at what you budgeted versus what you're actually spending when you're doing your cost reports. Those are some big ones that can come out and create problems. But go to the state, they're going to have a FAQ page, and as things come in, like I said, go to the state, that's their source, or your source, and they're the ones that are going to be collecting this. And I would presume, I'm not speaking on their behalf, but you should be, the state should, I'm hinting here, it would really be beneficial that they have an annual update. I know in multiple states we do an annual update, and that you should be tuned in to attending those annual updates, and they'll go over the things that come up. Remember, your program operates differently than every other program in the country. There's no other program in the country that'll operate like your program because of the way that they are calculating the costs, the way they're just redistributing the supplemental payment. So your issues, to some degree, will be unique to Washington. It's not to say that what they do in Florida, Nevada, California, that there aren't commonalities. But as they say, when you've seen one Medicaid program, you've seen one Medicaid program. So your issues will be unique to your state, so go to the state. They are your source. You're going to be reimbursing them for that cost, make them earn that money, and they want to earn that money because I can tell you your team is enthusiastic about this. So utilize those resources, okay?
Okay, so we're a volunteer fire district, and we have split our general or fire side and our EMS side budgets and things. How do you work that out? Do you base everything all together, or just the EMS side? Because
good question. So actually, that's not that uncommon. You've done it more formally that you have a suppression budget and you have a EMS budget, but in all reality, you're doing this on the cost report. You're identifying a bucket that is suppression, a bucket that is non-allocatable, a bucket that is shared costs. So on paper, while you have formally separated those out, that doesn't necessarily mean that the costs incurred on one budget item don't impact the other budget item. That's actually very common. So you can keep, for your accounting purposes, per your governmental structure, you can keep those separate, but the reality is the service you're delivering is not separate. In other words, an EMS call comes in, the ambulance guys don't go out because it's EMS, and the suppression guys don't go because it's not in their budget. So you're still rolling out, you can still blend them. The difference is your buckets are formalized for accounting, but the service you provide is still a blended service.
So, in other words, take the whole thing, and when you're doing your cost allocations, and do it that way.
I got to be careful because I can't tell you how to do this, but yeah, really what you're going to do is you're going to look at the overall service that you're providing. They're all underneath one roof, and so you're just simply going to do the same thing. You're going to account for all of those services and put them on your cost report. But from your governmental structure, if they budget out for suppression and budget out for EMS, it's probably easier because you would take your EMS budget, and that's going to be your Schedule 2, and then you're going to take your suppression budget and you're going to allocate over according to the shared cost, and then you'll have your other items just like everything else, which would be your non-allocatable. So it's no different, it's just the way you're structurally set up.
I got one additional comment.
Oh, Ken has a comment.
Yep. So For those of you that choose to participate in the GEMT program and move forward with the cost reports, I just caution you to make sure everything is well documented and you keep copies of everything, including your methodologies, the actual general ledger reports or other financial reports that support those numbers. We had one agency in California submitted their GEMT cost report. The person that did the work then left the agency. They were audited several years later, and nobody knew anything about the cost report or how it was put together. So it's important to document everything and keep all those documents. And I think there's in California, it's a 3-year period that the state has to come in to do the audit. So you want to at least keep the documents for whatever audit period is open, just like you would your personal taxes. Yes, sir.
So I think that there's a whole lot of people that are very interested in this. This has been very helpful. But I'm sure that as you guys started this in California, of those 148, you probably helped a lot of those, and those organizations became clients. It's probably a little bit tough for you to do consulting services from California up to here. But if somebody was looking to do this and was looking to hire a consultant to help them get through the first cost report, do you have recommendations relative to that? And I'm assuming that the cost of a consultant would then go into the next period for the expenses for this, correct?
Yes, that is correct. So any costs incurred for the preparation of the cost reports then become an eligible cost the following year. And from my personal experience, the folks at the agencies that I work with that use consultants to do their cost reports, everything's done via email. So they may come out to do 1 or 2 initial visits to talk about methodologies, but then they'll be requesting information on if it's square footage on buildings or a number of dispatch calls for EMS versus suppression. And, you know, my clients download the general ledger information, email it to the consultant, and off they go.
Just at least one last thing from us. This is a culmination of what, at least 4 years? 5, 3? Okay, maybe more credit than he deserved. But I want to thank the state fire chiefs. I want to thank Central Pierce, Chief Olson, for allowing Keith to continue to work on this. And most of all, our esteemed colleague, Keith Wright. I think we need to give it up for Keith and thank him for this.
I don't want you to not be able to walk out of the room because your head explodes, but I did want to say something similar. I was at the meeting where you and I first heard about this when Scott and Kurt were presenting, and I mean, you've hit the ground running. You had support on the Senate floor within 3 weeks. The bill passed the first session. We would have never been anywhere without that, and it's solely you, really. And then Healthcare Authority has been amazing. You know, Vesna before and Jean and Abby and now Shauna couldn't have done it, obviously, without them. They've just been so professional, and I'm just excited it's finally here.